Thank you for attending Kentucky State University's Small Farm Conference. I'm Dr. Jessie Lay. I'm the Extension Veterinarian here at KSU. Today's topic will be bovine viral diarrhea virus. So what is it? So bovine viral diarrhea virus, as the name suggests, can cause a viral diarrhea in cattle. But that's not the most common symptom. Right? More frequently, it causes pneumonia in calves or reproductive losses in adult cows. I really wish they'd changed the name of this virus, but when they discovered it, that's what they were looking at. This virus causes millions of dollars in losses in the cattle industry every year. Right? It's highly contagious between cattle. Right? We will never completely get rid of it because it is also found in wildlife, such as white-tailed deer or elk. But cattle are the primary host and the primary reservoirs for the virus. Right. So what are the symptoms? Yes, a lot of times in young calves it may cause diarrhea. The diarrhea only lasts a few days and supportive care. Many times we'll get them over it. It's also a frequent cause of bovine respiratory disease. Right? This is the common shipping fever syndrome. It's not the only cause of shipping fever, but it's one of them. It causes abortions and infertility in our adult cattle. And it may cause just a general immunosuppression that makes the cattle susceptible to other diseases as well. So the problem with it is it's got such a wide variety of symptoms. A farmer may have 3 or 4 calves with pneumonia. They may have 3 or 4 cows turn up open and not calve, and an abortion. By the time we connect the dots, usually the virus has spread through the entire herd. So let's talk about some of these economic losses, right? We want all animals to be healthy. I don't want to see any animals sick or suffering. But as farmers, we're also businessmen. So looking at the economic losses and the bottom line is important. So in the respiratory disease, right? So this is the classic shipping fever that's been around a long time. Calves will develop a fever, a cough. Usually they go off feed, right? A lot of times there's a secondary bacterial pneumonia from Pasteurella. We've all heard about the Pasteurella pneumonias, right? During the course of the illness, the calf may lose 100 or 200 pounds, right? And that's going to affect, right? We sell them by the pound. So when you go to sell that calf, if it's 100 pounds lighter than it should be, that's money that we've lost. Not to mention, when it was sick, if we gave it antibiotics, those weren't cheap either. Right? Or, in a lot of the severe cases, the calf can actually die of pneumonia. For our small farms, right, if you only have 20 calves to sell and one of them dies, that's a much larger hit than if you're dealing with a herd of 100 and one dies. But let's talk about some of the more subtle losses, the reproductive losses in the cows. So if a cow has infertility or early embryonic death of the fetus, right? So that means she reabsorbed it very early in pregnancy. You never saw symptoms of that. Right? The cow ran with the bull for 3 months, and then when you had them palpated, you had 3 or 4 cows open. Right. So that was money lost, right? That cow is still in her productive lifespan, right? But, right, a cow that does not have a calf eats the same amount of hay and grass as one that does, right? In cow-calf operations, right, a cow weaning a healthy calf is her rent payment, right? That's how she's paying her feed bill. Right. Or what if that cow aborts the calf late in gestation, right? These are when she's 7, 8 months along, and she kicks out a fetus that's too early to survive. So you've still lost the calf, and you fed her all year without a return on your investment. And then lastly, the cow may give birth to a persistently infected calf, which I'll talk about in just a minute. So this may cause her calf to have poor growth rates and wean much smaller than the rest of the calves, even though it wasn't her fault. So the types of infection, right? This is really important. There are 2 types of infections with this virus. The transient infection, okay, the infection that comes and goes. These are the calves that have, or cows that have all the symptoms that I just mentioned, right? These are the typical, an animal gets infected, they're sick, and then they get over it. Right? While the animal's sick, yes, it will be shedding the virus in its nasal secretions, saliva, or feces. And after 10 to 14 days, they get over it, and they have immunity for a few months. Right? Right? The persistently infected animal, this is much different. These animals don't get sick. They look healthy, right? They're the asymptomatic carriers. Yet these animals will, or these calves, will shed virus in all their body secretions for their entire life. Right? You're not looking at them because they're not the one that's sick. Yet they are the ones that are keeping every animal around them infected. Right? These calves often do have weaker immune systems, so they may get sick from other bacteria or viruses. So to understand how this happens, we need to talk about the immune system for a minute. All right? So the immune system is the body's protection, right? So every cell in our body has little proteins on the surface that identify it as, quote, self, right? Think of it as having a name badge. Right? The immune system's like a security guard that's going through the entire body, looking, checking everybody's badges, making sure it belongs there. When the immune system sees a virus or bacteria or fungus that doesn't belong, right? Any kind of cell or substance that doesn't have that name badge, it attacks it. Right? We see fever and swelling and inflammation and coughing. Those are all a product of the immune system attacking, right? That's that fight going on. Right. So, the persistently infected calf, how does this happen? Why is the immune system not fighting it? To become persistently infected, the calf is actually infected while it's still in the mother's uterus, right? So the immune system develops somewhere around 5 months in gestation, right? So if a cow, right, so a pregnant cow gets infected before she's 5 months pregnant, what will happen is she will get the infection, it'll travel through the bloodstream, and her immune system fights it. After 10 days, 2 weeks, she's fine, right? She may go off feed, but with a functioning immune system, can usually clear it. But the calf shared her blood, right? So that infection that was in, that virus that was in the bloodstream, also went into the uterus and got into the calf. The calf doesn't have an immune system yet. So if she doesn't abort that fetus, by the time the calf's immune system does develop, the virus is already there, right? So it never recognizes it as foreign. It's used to it. So it gives the virus a name badge, so to speak. All right? So once that calf is born, for its entire life, it's never going to fight the virus because it thinks it belongs there. All right, so this is just a little picture of possible scenarios. If a pregnant cow gets infected, if she gets infected that first month or two that she's bred, she usually just has infertility or reabsorbs that fetus and then comes back into heat, and you never know the difference, right? So 1 or 2 cows not getting bred isn't extremely alarming. You don't think anything about it. After 5 months, once the calf inside her has its own immune system, sometimes that calf will die fighting the virus inside her, and she'll have an abortion, right? It may be fully developed, it may be deformed, or maybe the fetus fights it off too and is born completely normal. The problem is that area in the middle, and that little window of 2 to 4 months, if the cow's infected, is what can give rise to that persistently infected calf. So why do we care? I said that the persistently infected calves don't get sick, so why do I care? Because they end up being a cesspool that exposes all the other animals, right? No, they're not getting sick, but they're causing death and infertility in every other animal in the herd, right? One PI calf running through a sale barn may end up exposing hundreds of other animals that somebody will take home, right? So until you figure out who, like which cow is persistently infected, you're never going to get pneumonia or the fertility losses cleared up in your herd. Well, there's the good news, we can test for it. So if we do a test on blood or nasal secretions, we can tell if the animal's infected at that point in time, right? But we can't tell if it's infected that week and it's going to clear it, or if it's the persistently infected. So the better test is an ear notch test, right? So there's this little device which will cut out a little wedge of tissue out of the ear. If we're seeing the virus in just random ear tissue, that's much more likely that the animal will be persistently infected. So it's a really easy process to do. You take the ear notch tool, like I said, it's got a little triangle-shaped knife in a clamp, right? So you take it to the edge of the ear, and you just clamp it, and it will cut out just a little triangle of tissue, right? It doesn't hit any big blood vessels. Like I said, it just takes out a very little piece, right? You can put that little triangle piece of ear in a run-of-the-mill sandwich bag, Ziploc bag, and with a Sharpie write the calf's number on it, right? You can take those samples to your local diagnostic lab or take them to your veterinarian, and the veterinarian can send them in for you. Right. There are chute side tests, right? So these work kind of like the old pregnancy tests do. 2 dots is positive, 1 dot's negative, right? These can be bought from your veterinarian and used on the farm. Now they do take 10 to 20 minutes. So if you're running 100 calves through the chute, wouldn't make sense to leave them standing in the chute that long, but it is much faster than sending the test off. If you're interested in doing these tests, talk to your veterinarian. Let them help you do it the first time, and then after that, you can do them yourself. Now, in Kentucky, BVD is regulated, or there is a control program by the state vet's office. There is in several other states as well. So no, when you have a positive case, the feds aren't going to come in and quarantine your herd, but they will get in contact with you and talk about the best options. All right. Well, so farmers ask, should I test everything? Actually, there's a shortcut. We don't have to test everything. So if a calf is negative, we know its mother is not persistently infected, right? If that cow had the lifelong infection, she would have obviously infected her own baby. So if we just test the calves, if the calf is negative, we know the cow is too. Now, if the calf comes back positive, we will have to go back and test mama. But, like I said, so that way it's a shortcut, so we're not having to spend so much money on testing. Don't forget about yearlings, right? So yearlings, if they weren't tested the year before as a calf, you should test them as well, and your bull. All right. And the biggest thing is I see people forget to test the cows that did not calf, right? So if she aborted a fetus at 7-8 months and didn't have a calf to test, right? I told you abortions could be a symptom. So that puts her on the suspect list. So any cow that doesn't have a calf when you're testing, you need to go back and test her as well. So what do you do if you do find a persistently infected calf? You can retest it 4 to 6 weeks to verify it, right? Make sure it wasn't a come and go infection. It needs to be separated from all the other animals. Like I said, these are the asymptomatic carriers, right? They're the ones spreading it. All right. There are a few farms that specifically buy these persistently infected calves, of course at a little cheaper price, but raise them up knowing they're taking the risk. You can keep it separate from the rest of the herd and feed it until it's a slaughter weight, right? So BVD does not affect the meat. We cannot catch it ourselves. So eating the meat from a persistently infected calf is fine for us, right? It may be in the bloodstream, but we can't catch it, and the blood's drained out of steak anyway, right? Or the last option, the best option, is to just euthanize it, right? So it is more economical to go ahead and euthanize it to prevent losses in all the other healthy animals. Keeping that PI calf is going to cause multiple of your healthy calves to die from pneumonia, and it's going to cause a lot of your cows to have abortions or infertility. All right. So farmers usually don't want to do this. My herd, I wouldn't want to put down a healthy calf either. Well, a calf that looked healthy. All right, so let's look at this though. Right. So let's say sell a group, you have a herd of 20 cows. Normal circumstances, you'd have 20 calves. Let's say you sold them when they were 500 pounds and the market that day was $1.40 per pound. Right. So it means each calf is worth $700. That persistently infected calf is worth $700, right? So what you would end up with is you would get a check for $13,000, right? Now you still have to pay for the cost of the feed of your cows, your farm payment, tractor, fuel, all your expenses. But let's throw one persistently infected calf in that herd. Well, now all of a sudden, because of the fertility problems, you had 20 cows and only 15 calves, right? Maybe some of them just didn't get bred or absorbed early or late abortions. Whichever route it went, you only ended up with 15 instead of 20 calves to sell, right? Of those 15 calves, right, that persistently infected one is still getting all the calves around it sick. So let's say 8 of those 15 calves Usually it's almost all of them, but for this purpose, we'll say 8. 8 of them get pneumonia, right? 3 calves die from pneumonia, but 5 you're able to give antibiotics and pull through it. But they still wean at lower weights. I've got some of the math worked out there. So you lost 3 calves that should have been $700 each, right? Or they weigh $100 less when you sold them because they were smaller. Plus, you have the cost of all of the antibiotics and all of your vet bills. In that scenario, when you took your calves to sell them, you only got $10,000, but you still had to subtract the feed cost of the full 20 cows, right? You still had the same farm payment, still had the same tractor and fuel cost. So that cuts your profit down to 1/3 of what it should have been because you had that one persistently infected calf, right? That one calf that was worth $700 has now cut your profits by 30%, right? Sometimes you got to fold a hand if you want to stay in the game. Good news is there's vaccines for it. There's lots and lots of vaccines. And this is the problem for a lot of producers. Because when we start talking about, microbiology, things get really confusing. There's so many different types of vaccines, and all are not created equal. And there's not one vaccine that's always going to be the best. So when we talk about vaccines, there's 2 types of vaccines. One is a modified live. So in a lab, this live virus was modified to not create very much symptoms of disease. You'll know these because most of the times they come as a liquid and a powder, and you got to mix them together, and it's kind of a pain. But, right, these live but modified virus cells are going to cause a stronger immune response, right? They are going to be more effective, in exposing the animal's immune system to it. Right? That's what we do with vaccines. We show it to the immune system. So the next time, like I said, that immune system's going through checking badges, it already knows they don't belong because it's threw it out once. Right? The problem, modified live viruses do give the animals a very mild form of the disease. Right? There can be side effects of infertility if you use them on breeding age cows. Right? But they do give the stronger immune response to calves, right? In calves, we always want to use the modified live, right? And it will say in capital letters, MLV on the label, right? The other type of vaccine is a killed vaccine. Right? Killed vaccines are much safer. We can use them on animals that are bred or getting ready to be bred. Like in this situation, the virus was killed in the lab and then attached to something to flag the immune system to it, right? So it doesn't actually give the animals a disease. But it doesn't give as strong of an immune response either. So calves should receive the modified live vaccine, right, at weaning, somewhere there around weaning, whether it's before you wean them, after you wean them. Talk to your herd veterinarian, see what they recommend on the exact time and what they like to do with preconditioning, right? And then we give a booster a month later, all right? And that booster is just going to make the immune system that much stronger. But the thing is once calves have that initial modified live vaccine, right? And it gives that strong immune response. From there on out, the killed vaccine will be just as effective. Think of it as the modified live vaccine priming the system, right? Once you've had that strong immune response to it, from that point on, when the cows are big enough to be bred, the killed vaccine works just as well. So it's very confusing when you go to your local feed store and you walk up to a refrigerator and there are 20 different brands of the same thing, right? But always look at if it's modified live or killed. Right. All right. There are other methods of prevention, right? So with COVID, they don't have a vaccine yet. So we've been told to social distance, right? And wear a mask. Hard to get a calf to wear a mask or social distance. But there are other things we can do. Anytime you decrease stress and provide adequate nutrition, keep out good mineral sources, right? This is going to go a long way in preventing all diseases, right? Testing. If you have a problem in your herd or even think it could be a possibility, go through and test, right? You got to get those PI animals out if you want to get it out of your herd, right? Vaccinations, giving the right type of vaccine at the right time. And then buying from a reliable source, right? When you go to a sale barn, I talked about that one PI calf infecting 300 calves at a sale barn, right? And somebody took those calves home. And a lot of the producers I work with, have the vet at the stockyards go ahead and vaccinate them. The problem is when you give a vaccine, the vaccine doesn't start working for 10 to 14 days. If the animal was exposed at the sale barn and vaccinated at the sale barn, it will still develop BVD. Right. Quarantine new animals, right? So putting each one in separate isolation would be best for at least 14 days. But usually we're buying them in groups. So if you buy a group of 10 calves this week, and then you buy a group of 10 calves next week, keep the groups separate. That way, if you do have an outbreak, at least it won't be through the entire group. And it's much more manageable when it's in small pockets of the herd. Right? And then don't forget about yourself. Right? So limit your travel from farms, right? Change your clothes if you've been to the stockyards, right? In my years of practice, right, I would get filthy during a day's work. When I got home, I would always change clothes and put on my home boots, right? Because I knew I'd worked with sick animals all day, and I didn't want to bring any of those pathogens back to my farm, right? So this is a really complicated disease, but it's really important to understand how it works. If you have any questions, feel free to reach out to me or talk to your local veterinarian. And like I said, I do want to thank you guys for coming to the Small Farms Conference.